Goeienaand, good evening, fellow South Africans and citizens of the world. You know, what's happening right now in the health system in South Africa is quite extraordinary. And there's several people I have to shout out and thank for sending me information. Marlena, Philippe, the couple of people who sent me the same, but there's just so much coming through about the health system right now. Let me remind you of one thing that Julius Chicken Man Malema, the CIC, said before the election. He said, we are going to have clinics in every single township, and they're going to be manned by nurses, so everybody gets great health care. That's the words out of the great Julius Malema's mouth. He knew he was talking bullshit, by the way. You know, he knows that the hospital system right now is in crisis in South Africa. And why shouldn't it be? You know, doctors have skills that allows them to move to other countries very easily. They're one of those fortunate group of people that other countries are seeking. And what are these South African people doing? I'm talking about the black thugs. What are they doing? They're attacking the doctors. They're forcing them. They're forcing their hand. You know, a lot of these doctors have tremendous goodwill. They're trying to help. And they are under so much duress because there is such a shortage of doctors. And this is how these thugs treat them. Let me just tell you. Just days after a female doctor fought off an alleged would-be rapist at Pelanomi Hospital in Bloemfontein, another female doctor was attacked and robbed on Saturday morning, according to EWN. On Saturday morning, a female doctor was accosted by 3 armed suspects in the parking lot of the facility, the publication reported. This follows an attack on a female doctor on Wednesday where she was attending to the 32-year-old suspect who was posing as a patient at the hospital. Police spokesman Colonel Thandi Mbambo said the suspect allegedly tried to rape the doctor who, in defense, bit his tongue off. Good move, as long as he doesn't have AIDS. Sowetan Live reported that Mbambo confirmed that the incident took place at about 5 a.m. on Saturday morning. The attackers made off with the doctor's cell phone. They also threatened the security personnel who came to her aid, the report said. Following the first incident, Free State Health Department spokesman Mondi Mvambi said security measures were put in place to make sure that breaches are attended to. But Mvambi said that Saturday morning incident, they were reviewing the current security plan. Not good enough. Mvambi said, the security managers must then assess the plan to effect immediate interventions of continued upscaling of security. But one of the contemplations we are making is to employ services of a tactical response unit. Can you believe it? They now need a tactical response unit in a hospital? Why can't they just get security guards who do their job? But, you know, we're talking about a fundamental problem at the sharp end of the health system, where doctors are just getting out of the country. And soon you will have many hospitals without one doctor servicing them. The only doctors who probably will stay in South Africa are those who are too old to leave. And, you know, once they're gone, you've then got these new doctors coming through who only have to get 30% in their matric, and because they're black, they get preferential treatment and get put to the head of the list. The quality of medical care in South Africa is going to be very questionable in a few years' time. There's no question about that. Now, this brings me to the comment that Philippe was raising, which was very, very interesting. And Philippe says as follows. He says, "Hi, Scott. They seem hell-bent on destroying anything that still works. They rob public hospitals blind, nothing left that works. Instead of stopping the plunder by staff and trying to rebuild those services, they simply target the private hospitals." Hear that? They're now targeting the private hospitals, like the private schools, which they want to nationalize. Bye-bye investment, bye-bye investors, bye-bye any chance of getting half-decent service and a semblance of a chance to recovery in the hospital system. And people have been paying a fortune to get medical aid cover to avoid the death traps public hospitals have become under the inspired ANC leadership. Zweli Mkhize is actually a qualified medical doctor. Of all people, he should know better than to relegate sophisticated private hospitals we still have to the level of third world death traps our erstwhile superb public hospitals have become since 1994. Wonderful prospect for tourists to be mistreated, robbed, raped, and probably murdered in their beds. Bring your own bedding. Should they have survived the hijackings that put them there? First, F up efficiently functioning security companies that offer some protection where the South African Police Service don't now. The hospitals. If the aim is a smoking hole, we're well on the way. Actually, clearing up the public hospitals and bringing them back to acceptable standards does not occur to them. Plenty of loot to be had in the private hospitals. You want to share an infectious disease paradise? Sorry, ward, with Africa's finest. Take a ticket. Sad to see this go. They have 5 years to plunder the hospitals and restock at 5 times the cost. Looting is easier with a project, and Mkhize has just the candidates to run and supply them. Now, the article that Philippe has attached is very interesting, and it's headed up National Health Insurance, a smokescreen for ANC's communist agenda. AfriForum condemns the announcement of Dr. Zweli Mkhize, the new Minister of Health, that the National Health Insurance Plan, or NHI, must be implemented as soon as possible. Mkhize said at a press conference on 7th June 2019 that it is not a question of whether the NHI would be implemented, but rather when, and that this system would eradicate inequality in healthcare. Mkhize's promises of a utopia for South African health system is, however, simply a smokescreen for the ANC to further its communist agenda. The vast majority of state hospitals and clinics do not comply with medical standards. That is why the state health sector has spent up to 56 billion rand, a quarter of last year's budget, for health services, for the payment of negligence claims. You get that? A quarter of last year's budget for health services was spent paying negligence claims of 56 billion rand. Incredible. It is a clear indication that the government cannot even properly manage the state health sector. This interference in the private health sector is contrary to free market principle and will eventually lead to the total collapse of the industry, said Natasha Venter, campaign official at AfriForum. Despite this, Mkhize is of the opinion that all issues in the Department of Health need not be resolved before the NHI is implemented. According to the Auditor General's report, the Department of Health received one of the worst audits of all departments in the 2017-2018 financial year. Hence, Mkhize's argument that the hospitals have little resources due to the country's overall financial woes and therefore cannot provide services properly is weak, said Venter. It is ironic that the minister chose to hold the media conference at the Mamelodi Hospital, where Martha Marais, 76, had her hands tied behind her back and she was left on the floor for 8 hours. Incredible. AfriForum is currently in the process of compiling a report on the defects of the health sector. The stories we receive from the public are frightening, and the implementation of the NHI will only lead to further and even worse horror stories. This is because the NHI will deprive everyone of their rights to decide which service provider they want to use, which will mean that private hospitals and clinics will no longer have to compete for patients, said Dr. Eugene Brink, AfriForum's strategic advisor for community affairs. So, what they haven't broken yet, they're breaking. That's the bottom line in South Africa. I don't think there are a few things remaining that aren't broken. apart from private schools. And as I said just now, they're talking about nationalising them, and then they'll be broken. What a sad state of affairs it is. It really is tragic. All right, guys, please remember to subscribe to be kept informed. Ring the bell to get the updates, and have a great evening.